Hey, thank you for being here today. My name is Summer. I'm a Columbus State RN to BSN program student, and this is my senior project, my evidence-based project, which is decreasing alarm fatigue. Thank you for being here, my guests, my audience. So, as you know, there are many issues in healthcare. There are anything from staffing ratios to other technologically induced problems. With the increase of technology comes the issues with things like problems with it that we have, such as alarm fatigue. So my project is how to reduce alarm fatigue in nursing. So we want to make sure that staff is educated appropriately, and then also that all the telemetry is required. The patients do require continuous telemetry monitoring. And also that resetting the parameters are specific to patients, which would decrease the noise on the floor, which is the alarm fatigue, increase the nurse response time, and also to increase the overall patient outcome. And also to develop a nurse-driven protocol for the removal of the telemetry. So what is alarm fatigue? It's the noise, it's the sounds. You hear it, it's beeping, something's going off. So it is the desensitization of nurses to hear this sound, and it's just so much that it begins to be a what's the boy cried wolf kind of scenario. So you hear it, and it ends up being a false alarm. Patch is off, the O2 sensor is not on correctly. So these can lead to having true emergencies overlooked, missed, delayed, and it delays the nurse's actual reaction time. So alarm fatigue is directly related to patient outcomes, their anxiety, their fears, the way that they heal, overall HCAP scores, and nurses' satisfaction, as well as their burnout. So our objectives for this is to decrease the number of false alarms. And we do that by verifying that these patients are clinically, the patients that need to have the telemetry monitoring. We don't want to put telemetry monitoring on somebody that is running normal sinus rhythm. They don't have any oxygenation problems or anything like that. And also that all the equipment is working and functioning appropriately. This will increase the patient outcomes by decreasing their overall anxiety, increasing patient restfulness, because as you know, nurses, hospitals are not somewhere where they can just go to sleep and get well, and increases the nurse response time. So this increases the HCAP scores and will help decrease the amount of nurse burnout. What needed for this is that with the sensory overload and the desensitization of the nurses from these alarms, so many of them are false alarms. So we want to make sure that these are, you know, when the alarms go off, these aren't something that is an unactionable. You know, going and putting a patch on, going to get the sensors back on the fingers. And we justify that because this telemetry monitoring is done in a central location. So while the alarms are not sounding on our floor, what we get in turn is the calls from telemetry. So they'll call and call and call. And this alarm fatigue is listed as one of the top 10 health hazards, technology hazards in acute care settings. So the benefits of this is the decrease of the noise on the floor. But like I said, because the alarms are not actually coming onto our floor, these are getting called in from the telemetry, and they'll call. And so with the nurses coming in, things are beeping, things are going off. We're coming in there saying, oh, let me check this, what's going on? It increases their anxiety. And this is something that is directly related to nursing care that we can actually help lower the issue. By reducing their anxiety, by not having quite as many telemetry monitors in there. So the stakeholders are everybody on the floor pretty much. Anybody that does any sort of health care, any sort of patient care, from techs and CNAs to the nursing, the charge nurse, all the way up to upper management when we start talking about the HCAP stores. So in developing a PICO question for my project, look at the problem is the alarm fatigue, and our intervention is the clinical use of telemetry monitoring. Is it required? Is it not required? So the comparison would be, do all the floors have the same number of telemetry monitors? Are they all needed? And the outcome is to decrease the noise and alarm fatigue, increase patient outcomes, decrease patient anxiety, and decrease false alarms, and increase nurse response time. So my PICO question is, will having the better policy and procedures in place on patients with telemetry help reduce alarm fatigue, therefore decrease in patient anxiety, increase nurse response time, and overall improvement to patient outcomes? So why should we make a change? The current situation on our floor is that while the alarms aren't going off here, telemetry is calling, and our policy actually states that they will call every 5 minutes. They'll start with the first person. They might call a tech or the nurse, depending on what the issue is, and then call back after 5 minutes, and then call back after 5 minutes, and it escalates and escalates. And there is no other policy that's in place that is such a technological hazard such as this. These false alarms do put our patients at risk because, well, we go in for these, like these boy cry wolf type scenarios. A true emergency and an actionable rhythm may occur, and it may be delayed, or we may overlook it. So, in recommendations for this protocol is that the patient should be assessed to see if they do require a telemetry monitoring or not. If they've maintained normal sinus rhythm and 90% or greater on their OT stats for 48 hours with no previous cardiac arrhythmias, they should be presented to the physician to have their telemetry discontinued. Also, patients that are non-compliant, they like to take their telemetry off or don't care that it's connected and will unravel the O2 probes or get in the shower with their telemetry on and just don't care. These non-compliant patients, maybe we need to not have it on them as well. So, but the patients that do require this cardiac monitoring, we do need to have this set because our current policy states that if his heart rate's 20 above, 10 to 20 below, without, if not bradycardic, that they, telemetry is going to call us. I have personally received a call from telemetry saying your patient's heart rate is 90, which is normal sinus rhythm. And but having this also to have staff adjust the leads, staff from telemetry, have them actually come because they are actually trained in this. This is what they do. They should have the staff that comes in and say, hey, if that leads off, they need to have staff that come in there and they replace that. So this needs to be evaluated probably by a non-involved member in the healthcare team, maybe someone from, HR or something like that can look at these numbers and tell, if there was, by these numbers of the actionable versus the unactionable alarms, also a nurse survey and how they feel about it, and also they can tell by the HCAP scores. Did they go up? Did they change? Did they not? So the patient's outcome is generally to increase because if, while there's been sentinel reports, sentinel events, and clinical alarm safety, all these things have gone on and which have, had hospitals that are actually required to develop and implement protocols aiming at curbing unnecessary alarms. So the patient outcome is going to go up. And as far as nurses, this is going to decrease the number of false alarms, which will reduce the alarm fatigue and the prevalence of nurse burnout. So, in conclusion, verifying that a patient does require this monitoring will help reduce the number of actual telemetry monitors that are on our floor that could result in false alarms. And we're setting all these defaults from whatever the defaults are to be a little bit more specific to that patient. And having a nurse-driven telemetry removal protocol and procedure will also help in assisting with reduction of nurse burnout, reducing the alarm fatigue, and increasing patients' overall outcomes. And that's it. Do you have any questions?
Yes, I have a question.
Okay.
Is there a policy in place like this at your facility?
There actually is. Right now, there's a nurse on 6. She's working with the director to actually develop and implement a procedure sort of like this for a nurse-driven telemetry removal protocol. Any other questions? All right. Well, thank you for being here, and I appreciate your time. I know you're busy, and you already showed me your little phone saying, not today, telemetry. So, you get back to work.